Hello and welcome to Anaphylaxis UK's Let's Talk About Allergies podcast. 30 years ago, Anaphylaxis UK, formerly known as Anaphylaxis Campaign, was set up with the core mission of preventing deaths from food-induced anaphylaxis and improving the quality of life for those living with serious allergies. At that time, so little was known about serious allergies, so people had little access to reliable information, and what was available was often inadequate. From day one, we've been dedicated to changing that by providing credible, accurate information, training and support. Over the past 3 decades, Anaphylaxis UK has made significant strides in raising awareness about the seriousness of allergies, and over the years we have offered a wealth of information to help individuals navigate the practical challenges of living with allergies. So as we recognise Anaphylaxis Awareness Week 2024 from the 1st to the 7th of October, we thought it was a good time to revisit some of our previous interviews, which contain essential information everyone should know about allergies and anaphylaxis. You'll hear expert advice on the different types of allergies, how to recognise symptoms, and what to do in the case of anaphylaxis. First, Dr. Helen Evans-Howells, a GP and allergy specialist doctor, talks with our CEO Simon Williams about the different types of allergies and the various symptoms associated with them.
Hi, Helen.
Hi, Simon.
Let me ask you, strip it back to basics. How would somebody know if their child has got an allergy?
Okay, so there's lots of different features that we look at when we're looking at whether or not someone has an allergy. And when you go and see somebody, hopefully with experience, there's going to be lots of features they ask you about. So what are the symptoms that you're describing? What's the timing involved after exposure to the allergen, the thing you think you're allergic to, and whether this has been happening every time they've been exposed. So if I just go back to the beginning, an allergy, for people who don't know, is an abnormal response by the immune system. So it's when the immune system is doing something it shouldn't and reacting in an abnormal way to something that should be harmless, like, say, milk or grass, pollen or cats. And then it sets up a fairly classical pattern of different signs and symptoms that can occur. Broadly speaking, there are different types of allergies. So we have one called IgE allergies and one called non-IgE allergies. And the IgE stands for immunoglobulin E, which is a type of immune cell. So the IgE allergies are generally the ones that most people recognise because they're the ones that are immediate and quite obvious. So they're the ones that produce hives, so a nettle sting type reaction, swelling, vomiting, tummy pain, diarrhea, possibly runny nose, runny itchy eyes, sneezing, and then in the worst case scenario, anaphylaxis with that one. And they come within minutes to an hour or two after exposure to the food, and they clear usually very quickly after exposure, so usually cleared within an hour or so.
So there we're talking about peanuts, egg, all the kind of ranges of foods, whereas where would you put hay fever, pet allergy, dust mites?
So they're still IgE type allergies. So they still would produce symptoms, but normally just the sort of nose and eye symptoms. So sneezing, congestion, runny, itchy eyes, sometimes breathing difficulties with it, particularly if someone has asthma, it could be a trigger for their asthma. But it's the food allergies that tend to produce the gut symptoms. And the main causes are things like egg, milk, soya, wheat, fish, shellfish, peanuts, tree nuts. Those are the commonest ones, but as we know these days, there are more and more things that people are allergic to. So the IgE allergies are quite easy in a sense because they happen every time the person's exposed to the food, usually very quickly. But if there's ever any doubt about the timing, you should speak to a healthcare professional. And they can be tested for. So we can do skin tests if you're in an allergy clinic, or a blood test potentially by your GP. The other type of allergies, the non-IgE allergies, these are much harder really because they have quite an insidious onset, so quite a slow onset, and they can occur anywhere between 2 and 72 hours after exposure to the food, rather than that immediate onset. So it can be really tricky to figure out, is this, what's going on here? And classically, they occur within the first few months of life often. So milk is a common one, so it causes a milk allergy, soya. So it might occur for a breastfed baby who suddenly has formula introduced, or it might occur at 6 months if this is the first time that milk products have actually been introduced, or you do sometimes get it in breastfed babies who are exclusively breastfed, but it is less common.
So what are the symptoms that are different then?
So the symptoms that you get with a non-IgE allergy tend to be very gut heavy. So you tend not to get you don't get hives and swelling. So we divide it into the upper gut and the lower gut. So when you're talking about upper gut, we talk about reflux. So you might see that with a baby because they might arch their back or be very unsettled with feeds. Occasionally they go a little bit blue around the mouth when they're feeding, and that should definitely be checked out. They're very unsettled generally. For the lower gut, these are bowel symptoms, so they tend to have lots of loose, frequent, explosive nappies that parents describe as kind of punamis that leak everywhere. They might have mucus in the stool, but some mucus is normal from a normal gut function. But if it was just covered in lots and lots of mucus, very watery, we'd be worried about that. If they're breastfed and have blood in the stool, that's a possible sign of allergy. And then sometimes they get what we call soft stool constipation. So they strain, and when they do go, it's soft, but they've seemed like they've been constipated getting to that point. They might get redness around the bottom. They tend to be really miserable babies. So it's worth thinking about how long does your child cry for a day? Because we all know babies cry, and crying for 3, 4, 5 hours a day actually can be normal, especially in the younger, months. But if you're crying for 12, 14 hours of a day, not normal, often a sign the baby's very irritable. So we look at those gut symptoms. And then when we look at skin, they can just have these kind of rashes that are appearing that you can't quite get a handle on what's going on. So they don't tend to be hives, but they can just look very rashy. And they also can get eczema. Now, the eczema itself is definitely not caused by the food, but it can be very hard to manage while the food is left in. So what we're looking at is if you've got really difficult to control eczema and several gut symptoms, then this might be a non-IgE allergy. And then the final kind of thing we look at is the respiratory system. So these babies tend to be quite congested and grunty and a bit snotty. But again, it wouldn't be the only sign of a non-IgE allergy. So we very much say that usually there are 2 systems involved. So maybe respiratory with some congestion and lots of liquid nappies, or lots of difficult skin rashes and reflux. So we're looking at 2 things. And if the baby has severe illness, then their height and or their weight may drop. But that doesn't happen in the mild to moderate illness, but it's still quite significant because they're still going to have a very miserable baby with lots of symptoms. So it still needs treating, but it's only the severe end where the growth is going to be affected. So it needs checking though.
And the difference between that serious allergy then and anaphylaxis?
So anaphylaxis occurs with the IgE allergies, so those more immediate ones. And you often get anaphylaxis in conjunction, so together with some skin signs like hives or swelling. But there is a proportion of people who won't have any skin signs, so it's not quite so obvious what's going on, and they just get symptoms of anaphylaxis. And symptoms of anaphylaxis, well, everyone often knows about breathing difficulties, but they don't realise it has other features. So we look at A, B, C. So A for airway. So they might be coughing. The voice might go different, a bit like croaky, like you've got a sore throat. Tongue swelling and dribbling. B is for obvious breathing difficulties. So noisy, wheezy, breathing quicker. And C is for circulation or conscious level difficulties. So they might be, say they're dizzy if they're older. A young child might go floppy. And of course, if you had severe anaphylaxis, then you may collapse and become unconscious. But it doesn't happen with non-IgE allergies. So they're both potentially severe allergies because IgE allergies bring with it the risk of anaphylaxis and therefore potentially, but thankfully rarely, death. And non-IgE allergies, whilst it doesn't have that risk of anaphylaxis, it does have risk that it will affect the growth of the baby. And of course, that in itself is serious. So both allergies are life-changing and affecting and need to be recognised. But the non-IgE allergies, because there's no tests that exist, it's much harder and often missed by clinicians and doctors for quite some time. So as families, they need to be thinking, what are the different things that my child has? And then sometimes taking that to your doctor and saying, I'm worried about non-IgE allergy because they've got this, 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 and this. And that will help remind the person in front of them about this particular illness, which is often not as well understood.
Now we hear from Professor Adam Fox, a professor of paediatric allergy, who discusses the most common signs of an allergic reaction. He again emphasises the symptoms that may indicate a more severe response and explains the importance of recognising when a situation becomes a medical emergency.
Most allergic reactions, thankfully, are quite mild. So the typical signs of a food allergic reaction would be itchiness around the mouth, redness, maybe some hives, sometimes some swelling. But there are signs that could suggest that there may be a more serious reaction going on. So, for example, anything that's affecting the breathing, so persistent coughing, shortness of breath, chest tightness, a change in your voice, for example, or anything that's affecting blood pressure. So that would usually show itself as things like confusion, dizziness, or just a sense that something awful is about to happen. We refer to that as a sense of impending doom. Any sign of a severe reaction, for example, involving breathing or your circulation, that's a medical emergency. If there's adrenaline to hand in the form of an auto-injector, that's the time to be giving it, and make sure that somebody calls for help. If you're not sure if the reaction's that bad, you're better off just using the adrenaline anyway, because it's completely harmless.
Next, Professor Fox discusses the importance of lying down during a serious allergic reaction.
There's been lots of studies that have looked at what happens when you have a severe reaction and when people tend to do better or not so well after having that reaction. And what those studies have shown is that when people try to stand up or move around a lot when they're having a bad reaction, they're more likely to have a serious outcome. We therefore always recommend that if you're having an allergic reaction, you either lie down or sit down, whichever's more comfortable. Sometimes if you've got difficulty with breathing, it's more comfortable to sit up. But what you shouldn't be doing is trying to stand somebody up if they're having a bad reaction or move them around. What essentially might happen is that standing them up can lead to a significant drop in their blood pressure, which can be a very, very serious thing for them.
Finally, we return to Dr. Evans-Howells, who sheds light on the truth about home allergy tests, highlighting the importance of consulting healthcare professionals for accurate diagnosis and management.
Question I get asked a lot working privately and as a GP of, I just want a test, I don't want anything else. And my answer is always no. And it's because the most crucial bit of understanding if someone has allergies is taking the history first. So finding out, have you ever eaten this food? If you did, what's happened? Because if they've eaten it and they have no symptoms, and we're talking here about IgE allergies, so ones that involve immunoglobulin E, so that's hives, swelling, vomiting, anaphylaxis. If they have none of those symptoms and the test is positive, it doesn't mean you're allergic. The other tricky thing that we have is that people, if they've had definite allergic symptoms, very occasionally the test is negative. And then if you believe that test, you're going to go on and potentially put yourself at risk. And that notoriously happens with sesame. So we need to be very careful. And finally, my biggest risk group are people with eczema, particularly young children. And if they've never eaten that food before, the test means nothing. So we have no idea now what context to put this test result in. Are you allergic or not when you've never eaten it? And children with eczema have risks of having very high allergy tests, but are only 50 to 60% accurate. And we have very good evidence then saying if you don't eat foods regularly, you're going to become allergic. So based on a test would say, well, for safety, you're going to have to not eat it. And actually, we just don't know whether you should be or not. And although families get very anxious about weaning, I do say, look, the risks of death are pretty much zero in a weaning child. It's much better and safer to give the food, know whether we're dealing with allergy or not, rather than avoid it, allow potentially allergy to form, and then have much higher risk of anaphylaxis and death as you become a teenager.
While significant progress has been made in raising awareness about serious allergies and their practical challenges, there remains a critical need to address the often hidden emotional challenges faced by those living with or caring for someone with serious allergies. With this in mind, our theme for Anaphylaxis Awareness Week 2024 is the hidden battle with allergies. Stay tuned for the next few episodes, where we'll explore allergy-related anxiety, including a newly recorded episode with Professor Chrissy Jones. So join us from October 1st to 7th as we raise awareness about anaphylaxis and support those affected by serious allergies. Together, we can make this year's Anaphylaxis Awareness Week the most impactful yet, creating a safer and more inclusive future for everyone.